My name is Siyona Bordia, and I'm here to present my research at the 2024 Global Health Leaders Conference. Just to start with my intro, I am a rising senior from Newark Academy in New Jersey, and I'm interested in exploring the intersection of women's health and economics. I'm also the founder of two organizations, Rightfully Hers in the field of women's empowerment and Musician Circle, where I organize performance opportunities for young artists in the local community. My paper looks at how different socioeconomic determinants affect maternal mortality in the United States. Just some background, what is MMR? The CDC, or the Center of Disease Control and Prevention, defines maternal mortality rate, or MMR, to be the number of mothers who died as a proportion of the number of live births, always per 100,000 live births. MMRs are significant benchmarks for measuring the quality of a healthcare and outcome of a nation. Variable MMR can also reflect disparities in social determinants such as income, access to healthcare, and education. The WHO explains social determinants of health, SDHs, as the living conditions of people that affect their health and well-being. In this study, we tested the assumption that race and ethnicity, income, education, and health insurance level influence MMR in the United States. As for methods, we utilized retrospective data from the National Vital Statistics System and CDC to compute U.S. state-level MMR by race and ethnicity. We also utilized U.S. Census Bureau state-level data from the American Community Survey for the factors of median household income, percent college-educated rates, and percent uninsured rates by race and ethnicity. In addition, we used regression analyses to understand the association between MMR and these factors. Data from women of three different populations by race and ethnicity were analyzed: non-Hispanic Blacks, or Blacks, non-Hispanic Whites, or Whites, and Hispanics. To study the effect of these socioeconomic variables on MMR, we first tabulated MMR by state for the three populations along with the key demographic variables, if you look at this table right over here. These results comprise data in 16 U.S. states, and they all had available maternal mortality data in each of the three racial groups. Of note, together these 16 states accounted for about 2/3 of live births and maternal mortalities in the dataset, and approximately 2/3 of the U.S. population. As shown here, each of the variable with darker shades of green represent more favorable values of maternal health. Darker shades of red represent less favorable values, and lighter shades of any color represent intermediate values. In general, we also found that the MMR was numerically highest in Blacks, as Blacks are blue and they have the highest MMR, and they also had the least favorable social determinants. In contrast, the white population had low MMR and more favorable SDHs. Interestingly, Hispanics had MMRs similar, numerically closer to whites, despite worse SDHs. White is gray and Hispanics are orange in the diagram. First, we plotted MMR by state and race along with the median income for the matching state and race combinations. MMRs were generally higher in regions and races where median incomes were lower, demonstrating an inverse relationship, as you can see in this graph. MMR for Blacks, in gray, were the highest of all races even when median incomes were similar, suggesting that race could be associated with changes in MMR. Second, we plotted MMR by state and race with the percentage of populations that was uninsured. We noted that Hispanics, in orange, generally had the highest uninsured percentages, followed by the Blacks. As the percent of uninsured decreased within a race, MMR generally decreased as well. Interestingly, while the Hispanics had some of the highest uninsured percentages, their MMRs were still lower than Blacks. Finally, we plotted MMR by state and race with the percentage of the population that was college educated. Higher percentages of college education rates were associated with a trend of decreasing MMR within the same race, as you can see in this figure. This data suggested a trend of increasing MMR with lower median income, lower education levels, and higher percent uninsured populations, as well as higher MMR with the Black race. After studying each of the SDH variables individually with MMR, we conducted a multi-step regression analysis to understand the overall relationship between the different SDH factors with MMR. MMR was the independent variable for our study, and the SDH factors of race, median income, uninsured rate, and college educated rate were the four independent variables. Upon analysis, the race of Blacks and Hispanics, as well as percent uninsured, had a statistically significant relationship with changes in MMR, as p-values were less than 0.05. However, median income and percent college educated did not initially appear significant. However, to check whether median income and percent college educated were correlated in the regression model on MMR, they were both regressed as independent variables individually without the other present. Eventually, median income was also found to be significant with a p-value of far less than 0.01. Finally, to quantify the effect of these independent variables on MMR, a sensitivity analysis was conducted based on the results of the second regression. We first computed the MMR for varying levels of uninsured rates starting from 0.05 to 0.15, which corresponds to levels of 5, 10, and 15% uninsured, using the coefficients derived from the second regression. We found that MMR was associated with a 2% increase for every 1% point increase in uninsured rates, regardless of race. We also found that for every $1,000 increase in income, MMR decreased by 1.04%. In addition, blacks had an MMR 1.99 times that of whites, while Hispanics had an MMR 0.66 times of whites for the same percent of uninsured population and same income, and this can be described in this figure. Hence, our analysis suggests that Black race, median income, and higher percent uninsured rates are associated with increased maternal mortality in the United States. We also explored a certain paradox called the Hispanic paradox, which we can read more in the paper. Our study suggests that race, median income, and uninsured percentage may play an important role in the maternal mortality outcomes for many U.S. states. We have some limitations to our study, including lack of publicly available data from CDC and ACS, as well as differences in implementation of data. But overall, more research is needed to further study the effect of social determinants on maternal mortality in the United States, and we must have multifaceted efforts to ensure better maternal health outcomes for all. Here are my references, and I'd like to thank out my family and my mentors, Dr. Yashika Shah, the senior author of this paper, Dr. Gwyneth Lee, and Ms. Nancy Salenti. Please feel free to reach out with any questions about my research. Here's my contact information, and thank you very much.